there, it's Dr. Sarah Trunk again from Balance Within Physical Therapy. Today I wanted to talk about the role of the pelvic floor in driving hip pain and why it's such an important and unfortunately very commonly missed piece of the puzzle with people with stubborn hip pain, arthritis, and especially people that have had a labral tear or labral tear surgery, and maybe they're about 70–80% better, but just can't quite get over the hump to get 100% of the way better after the surgery like that. So many people don't know this, but our pelvic floor, several of the muscles are actually considered hip rotators and hip stabilizers. So what I mean by that is, if you think of our hip joint, it's a ball and socket joint, right? So thinking of that ball and socket, we'll pretend like my hand's the socket and this is the ball. So for our hips to function really well, they need to be able to slide and glide that nicely. Of course, it's much smoother than my, bony fist and hand, but you get the idea. So some of the pelvic floor muscles run horizontally from the pelvis out to the hip. So they run like this. And if they're really tight, since they run across that path and cross the joint, they jam the ball into the socket. And so of course that doesn't feel great. You can imagine what like a jammed finger might have felt like playing basketball. And if it's a big hip joint, that doesn't feel great either. So some people might also have some pelvic pain if that's going on, maybe some pain with intercourse, or even some changes in bowel and bladder issues if their pelvic floor is in spasm. But we're talking about hip pain right now. So anyways, I just wanted to give you that visual of things running horizontally and how it can jam up the joint. So when we're treating hips, it's really common and helpful to loosen up the capsule around the joint, make sure all the muscles surrounding the joint and the connective tissue or fascia, which is really a specialty of our clinic, is loose enough to let everything move like it should and slide and glide. And then making sure that all of those stabilization muscles are strong and coordinating really well to stabilize that joint and have us not get extra wear and tear on our hips as well. When it comes to the pelvic floor, addressing that piece of the puzzle, those are muscles too. So they need to be loose enough to not jam things up or cause problems or cause pain. The fascia in that area or that connective tissue, same thing. It needs to not be too tight to allow the movement that's necessary. And then those pelvic floor muscles need to stabilize us and support us and coordinate really well, just like any other muscle in our body. And so those are the pieces that we look at. And it's really common with people with hip pain that maybe have tried other approaches or maybe even tried traditional physical therapy. If they're not quite 100% and it feels like something's missing, there's a good chance that something probably is missing. So thankfully, we're so grateful at our clinic that we spend so much time with our patients, and I always call us the nerds of the nerds in the physical therapy world. We just love to learn and have so many different specialties. And so we're really known for finding those missing links with tricky cases. And so I'm so glad I was able to share this with you today, that the pelvic floor can be on your radar too. So if you or someone you love is unfortunately dealing with tricky hip pain, just know that we are happy to be a resource, and we do offer free consults over the phone or in person if you'd like us to touch base, hear what's going on, maybe do an examination and see if we might be able to help you in a natural way without any medications or surgery. You can learn more at www.balancewithinpt.com. Thanks again for listening, and I hope you have a really great day.